everybody, it's Emily. We're going to be talking about week 6's content for sexual orientations and health. This week's readings and required listening was depressing, I would say, but also really interesting to see and look at, especially for some of the data that we saw in differences between women who have sex with women and men who have sex with men, especially for their health outcomes following sex-specific cancers like breast cancer versus prostate cancer. But I thought I got the most insight as somebody trying to go into applied public health and applied epi in the video with the LGBTQI plus Cancer Network. They highlighted that LGBT distrust in health providers was a big reason why people don't get screened as often as they should, or maybe they have worse health outcomes due to discrimination against being LGBT from certain health providers. As somebody who lived in a state that had these issues, Florida, when funding is threatened for undergoing research dealing with sexually diverse and gender diverse populations, it gets really difficult to be open about whether you are supportive or not supportive, but also lack of training or lack of awareness in states where it is safe or is fine to be talking about being LGBT safe makes a lot of patients feel unsafe going to the doctor. They feel like they might have some retaliation if they disclose their sexuality or gender. And I would think further education and more awareness might help this issue. But speaking on the readings, I did like Harmon's use of qualitative and quantitative analysis methods. As somebody who one of my undergrad degrees was in biomedical anthropology, and now I'm majoring in epidemiology, I'm always interested in learning methods that involve both quantitative and qualitative data. And the emphasis on LGBT-specific issues and safety issues, obviously linked back to the video that we had to watch, and treatment outcomes, all directly related to comfort with providers. Like, for example, the home health aide that somebody had, they thought they were going to die in their shower because they weren't getting treated properly by the home health aide, despite maybe their doctors and the rest of the health system being pretty accepting. And this, providers' assumptions can kill. For example, when I think it was the video or one of the readings, I forget which, they were talking about how somebody's chest, heart palpitations and chest issues was just attributed to their anxiety, and it turns out they had a chest tumor, So these can be deadly assumptions, deadly issues. And someone also had mentioned that transitioning had led to hostility, denial of treatment, etc., which shouldn't be a thing, but we see it. And I feel as though intersectionality should be emphasized in all studies related to this, especially because trans women of color tend to be treated the worst out of anybody dealing with discrimination for their sex or gender or sexuality, especially in the healthcare system. Minorities do tend to have worse outcomes when it's coupled with being sexual or gender diverse. And yeah, I thought this was a really interesting week. Again, really depressing week content-wise, but I feel like it's really important to talk about. So I hope you guys have a good day.